I'm SHERRICE Rose.
And I'm SHENNAH CAPERTON.
And we're clinic co-directors and physical therapists at Therapydia, Tampa.
And today we're going to be talking to you a little bit about sciatica.
Sciatica is a word that most of us are familiar with, but oftentimes as physical therapists we find that our patients are not entirely aware of what it actually means. First of all, sciatica is not a diagnosis in and of itself. It is actually a symptom of various conditions that are often musculoskeletal in nature. Sciatica may include radiating pain, numbness, tingling, or burning that originates in either the lumbar spine or gluteal region and travels along the posterior aspect or back of the thigh into the lower leg and foot. So quite literally, it is a pain in the butt. In most severe cases, it may also be accompanied by weakness of the hamstring muscles and/or muscles of the ankle and the foot. The sciatic nerve is the largest nerve in the body and arises from the ventral rami, which include both sensory and motor branches of L4 through S3. As it reaches the popliteal fossa, or the back of the knee, the sciatic nerve then divides into tibial and common fibular nerves.
Common conditions that may cause sciatica are bulging or herniated discs in the lumbar spine that are impinging or pressing on the sciatic nerve, spinal stenosis, which is a narrowing of the spinal canal that can cause increased pressure on the spinal nerves, spondylolisthesis, which is a forward slippage or displacement of a vertebrae that can compress the spinal nerves as they enter the sacral canal. Also piriformis syndrome, which is very common and is tightness or spasms of a small muscle deep in the buttocks that can push increased pressure on the sciatic nerve when the muscle is in a shortened position. And finally, pregnancy, which most of us don't realize. This can cause compression on the sciatic nerve due to various reasons, including increased fluid retention, expanding of the uterus, an increase of the lordotic curve in the lumbar spine as the baby grows, and lastly, the head of the baby resting directly on the sciatic nerve as it shifts into position for birth during the third trimester.
Sciatica often starts gradually and can be worsened by prolonged sitting or standing, when coughing, laughing, or sneezing, when bending forward or backward, or when walking or sleeping.
Sciatica is typically identified by performing a thorough musculoskeletal evaluation that assesses the range of motion of your spine and hips, the strength of your core musculature and legs, your lower extremity flexibility, reflexes, and sensation, any areas of muscular tenderness, and specific special tests that place stress on the sciatic nerve, including the slump test and the straight leg raise test. The slump test is a provocative test designed to assess neural tension in the spinal canal and lower extremity. The patient is seated with their hips in a neutral position with their hands behind their back. They are then asked to slump into a position of thoracic and lumbar flexion, followed by cervical flexion, knee extension, and ankle dorsiflexion. These movements can be performed actively by the patient or passively by the examiner to provide overpressure. Both legs should always be tested. While the patient may report discomfort on one or both sides while in the test position, it is only considered a positive result if their initial symptoms are reproduced.
The straight leg raise test is one of the most commonly performed neurological tests of the lower leg. The patient lies in a supine position with their legs extended while the examiner passively raises or flexes the hip until the patient complains of pain or tightness in the lower back or the back of the leg. If pain is provoked, the leg is then lowered slowly until the pain subsides. The examiner may then passively dorsiflex the patient's foot or ask the patient to flex the neck until the chin touches the chest. If their pain returns, it is considered a positive test and indicates stress on the neurological tissue. Not all causes of sciatica are preventable. However, taking steps to protect your spine and improve your posture can greatly reduce your risk of injury. Here are some helpful hints to get you started.
Practice proper lifting mechanics. Make sure you hold the object close to your chest and keep your back straight, using the muscles of your hips and your legs to control your body as you squat down to lift and lower. Rounding the back while lifting causes increased stress to the spine and discs and increases your chance of a muscle strain.
Avoid or refrain from cigarette smoking. Smoking not only affects your respiratory and cardiovascular systems, it also promotes disc degeneration, and this can lead to increased pressure on the spinal nerves.
Practice proper posture when sitting, standing, and sleeping. If you have a desk job or one that requires long bouts of driving, make sure you have good lumbar support in your chair or make an effort to stand up and move around every 30 to 45 minutes to relieve pressure on the lumbar spine and or your piriformis muscle. It is best to either sleep on your back with your legs elevated or on your side with your knees slightly bent with a pillow between them to provide increased nutrition to the discs of your spine. Also, avoid placing your wallet in your back pocket for you gentlemen. This causes the pelvis to be uneven when sitting and can put increased pressure on the piriformis muscle.
Exercise regularly. Your physical therapist is a great source of information regarding the proper stretching and strengthening exercises you can perform to help improve your flexibility and strengthen your core and hip musculature. And here are 3 of our favorite exercises to help address the impairments often associated with sciatica.
The first is sciatic nerve glides. The patient lies in supine with their knees bent and then gently pulls one thigh toward their chest until they're holding their hip in a 90-degree angle. They then extend their knee as far as they comfortably can and flex and extend their ankle if able. This motion helps to reduce neural tension in the leg and assists the sciatic nerve in gliding smoothly inside of the sheath where it resides. A good starting point for repetitions is 2 sets of 15, but may vary based on patient tolerance.
Second exercise is piriformis stretching. The patient lies in supine. Depending on their flexibility, level of pain, and whether or not they have a spinal pathology, they may begin with both legs bent or straight. Bending the knees is an easier variation and reduces stress to the lumbar spine. The patient then reaches for the outside of one knee and gently pulls it up and across their body, aiming toward their opposite shoulder until they feel a comfortable stretch in their buttock region. If performing the bent knee variation, the patient may rest the ankle of the leg they are stretching on the opposite knee in order to assist in supporting the weight of the leg. They would then attempt to hold for 30 seconds and perform 3 repetitions on each side.
The third is core stabilization training. The transverse abdominis muscle is the deepest abdominal muscle. It normally contracts prior to upper and lower extremity movement in an effort to stabilize the lower back and pelvis. However, in patients with low back pain, there's a delay in the contraction of the transverse abdominis. It is imperative to guide the patient through the optimal transverse abdominis contraction training. The patient will lie in supine in a hook-lying position with a stabilizer pressure biofeedback unit placed under their lower back. Pump up the stabilizer unit until the patient feels the bag engage in the lower back. This desired starting pressure will fluctuate per patient based on the lumbar spinal curvature. At this point, guide the patient to the location of the transverse abdominis through palpation. As the patient inhales through the nose, teach them how to exhale through their mouth as they contract the lower abdominals. Then document the patient's strength and endurance of the contraction. This provides tactile and visual feedback to the patient to allow for optimal training. The patient can begin with daily exercise sessions of transverse abdominis training at 10 seconds for 10 to 15 repetitions. A progression can be made into abdominal bracing with unilateral or bilateral isometric hip flexion. Transverse abdominis activation in quadruped is also an alternative position for training.
We hope you enjoyed our sciatica video.
If you have any further questions, please feel free to contact your local Therapydia clinic.
Stay well!